Bismillahirrahmanirrahim. My name is Muzammil Khan. I am with my groupmates Dr. Ayesha as a doctor and Dr. Ehtasham as a patient. Now we are here to present the physical examination of endocrine system. First we see endocrine. What are endocrine glands? Endocrine glands are the tissues or the organs that excrete chemical substances, hormones directly into the blood. So here are the some glands and their hormones. First, there is pituitary gland which secretes growth hormone, thyroid and thyroxine. Parathyroid secretes the parathormone, adrenaline, pancreas, insulin. Now here is the physical examination of endocrine general, in which we see the general examination. In the general examination, first we have to see color, temperature, hydration, edema, nutritional status, lymph nodes, hands and the upper limbs, vitamin and trace element deficiencies. The endocrine system symptoms in the endocrinology general endocrine examination, examining the thyroid, examining the patient with diabetes. First, how to approach the physical examination. In the first step, general conduct, the format of the examination, the right approach, the system examinations, and the examination framework. Each system examination is divided into 4 categories. First, inspection, palpation, percussions, and the auscultations. Here we have to see vital signs, temperature, blood pressure, pulse, oxygen saturation, respiratory rate, and blood glucose. And in the first impression, diagnosis at first sight. And here we see is the patient is well nourished or hydrated, and beside you set of Dr. Ayesha will examine the patient and introduce her.
Assalamu alaikum. My name is Ayesha Zahir. I'm final year medical student. Can I know your name, please? Okay. What's your age? 23. Okay. So we will be going to perform the examination of endocrine system later. Okay. Next.
In the general examination, we have to see first color. In it, we see pallor, cyanosis, central cyanosis, peripheral cyanosis, jaundice, other abdominal abnormalities of the colorations. Then we have to see the temperature, record the patient's temperature using either a mercury or electronic thermometer. Normal oral temperature is usually considered to be 37 degrees centigrade. And here rectal temperature will be 0.5 degrees centigrade higher, and the auxiliary temperature is 0.5 degrees centigrade. Then we have to see the lymph nodes. In here, Dr. Ayesha will tell us how to examine the lymph nodes.
First of all, I would like to go from the general examination. So, I would like to ask you some question, and I will start with general inspection. Please, I would like to see your hands. Okay. For the hand, I am trying to see his skin. If the skin is dry, that is related to hyperthyroidism, and if I am going to see for palmar erythema, hyperthyroidism, and if there is sweat on the hand, that is related to the hyperthyroidism. Okay, I am going to feel his pulse. Okay, why I am doing this? It is related to because pulse is increased in hyperthyroidism and it is decreased in case of hypothyroidism. Okay, and there will be, and if the pulse is irregular, that is related to atrial fibrillation. Okay, and for inspection I am going to see his face, and how his face is related to this. In hyperthyroidism there is sweating in the case of the forehead and related, and in hypothyroidism skin will be dry and there is loss of the outer third of the eyebrow. And from the eyes, I'm going to inspect, see for exophthalmos, which is related in case of Graves' disease. And I'm going to perform some examination. So you have to see on my hand, okay? Okay. Did you notice any double vision?
No.
Okay. What I did, I just inspect for pain or any kind of double vision, and I access for lid leg, and for that I ask him to follow the finger. And for inspection of the neck, okay, for neck, I'm trying to see any scar that is related to thyroidectomy, and any message that is related to the goiter or any lymph node, okay. And now act like that you are swallowing something, okay. Thank you. For that, I try to observe that whether there is any kind of mass that is related to thyroid or not. Palpation. So I am going to palpate for his lymph node and thyroid.
So after the inspection of lymph nodes, then we have to do the inspection of hands and the upper limbs. Here are the some. Here are the some. Uh, here are the some hands and the upper limbs in which we have to see skin color, discrete lesions, muscles, joints, bony deformities, and so on. Then we have to inspect the vitamins and the trace elements. Here are some vitamins, and here are some trace elements. Trace elements. So then we have to see the symptoms in endocrinology. Here are some symptoms in which we have appetite and weight changes, lethargy, bowel habit, urinary frequency and pylorrhea, thirst and polydipsia, sweating, pigmentation, hair distribution, and flushing. Here is some detail about these symptoms. So we just do it in a short time. In appetite, we have to see many people do not weight themselves but may have noticed consequences of weight changes such as clothes become looser or tighter. In lethargy, it's a type of fatigue as difficult symptom to pin down. In it, fatigue may be feature of undiagnosed endocrine disease such as diabetes mellitus, Cushing syndrome, hypoandrogenism, hypothyroidism, and hypercalcemia. Third one is bowel habit. Bowel habit, constipation. In the bowel habit, constipation is a common feature of the hypercalcemia and the hyperthyroidism. Hyperthyroidism and the Addison disease may give diarrhea. And at the fourth one, urinary frequency and the pylorrhea, in which we see endocrine causes might include diabetes mellitus, diabetes insipidus, and here are the thirst and polydipsia, sweating. So sixth symptom of the endocrinology is pigmentation and hair distribution, hair gain, skin and the soft tissues changes. In skin and the soft tissue changes, we see hypothyroidism, hyperthyroidism, and hypoparathyroidism, diabetes mellitus, acromegaly, headache, and visual disturbance. Here are the few more alternation in the growth, changes in the sexual function, and the flushing. These were the symptoms in the endocrinology. So here is the general endocrine examination. It is not possible to perform an examination of the endocrine system in the same way that you may examine other organ system. Usually an endocrine examination is focused looking for signs to confirm or refute the differential diagnosis that you have developed. So in the general endocrine system, we have to inspect, as we have discussed before, hands and arms, then we have axilla, then we will go to the face and mouth, neck, chest, abdomen, and legs, height and weight. Then the inspection, palpations, okay. Dila
Auscultation.
auscultation. In the auscultation, apply the diaphragm of the stethoscope over each lobe of the thyroid gland and auscultate for a bruit. A soft bruit is indicative of the increased blood flow, which is characteristic of the hyperthyroid goiter seen in the Graves' disease. So this is the examine of thyroid. How to do a thyroid neck check. Dr. Aisha will tell us how to check the thyroid.
So I'm going for the thyroid gland checkup. For that, I'm going to palpate for thyroid gland, and here we are checking for whether that is enlarged or not. And then I'm going for the percussion. Okay, I am going to check auscultation. I am going for first we did inspection, then we did palpation, and then we did for the auscultation. So so I would like to summarize this case as you.
Oh, yes. Dr. Aisha has already examined the thyroid gland, so we will go to the next slide. Okay. Yeah. Okay, Dr. Aisha will summarize the thyroid gland.
I perform an examination, and I'm going to summarize that on general examination of Ehtasham. There is no tremor of his outstretched hand, but there were no other peripheral stigmata of thyroid disease. There was no evidence of thyroid diseases and no evidence of goiter. To complete my examination, I would like to do some blood tests and look specifically for T4 and TSH levels. Thank you.